work. In our previous videos, we're focusing on Melissa in the lower body and back and neck, and I'd like to continue that theme by working in the posterior aspect of her lower body. So we're going to be addressing the gluteals, hamstrings, gastroc, and the feet. And when I say addressing the lower body, I mean just that with some nice, lovely integrative body work. So we're going to be looking at the physical and energetic anatomy and the techniques that we can use. And I'm going to focus primarily using my knees and my feet to address the body. One of the reasons I choose knees and feet in this situation is because how they match up with the areas we're working on. We're working on some of the stronger, bigger muscles of the body. So I like what I choose to work with to be applicable to the size of the area we're working on. So I'm just doing a little general loosening here. And again, like I mentioned, every movement and technique does give you some information. It is somewhat of a form of diagnosis to base what you're going to do or not do, which is equally as important of what you do and what you don't do. So just a little general loosening here, just to get a sense of the movement or lack of it. And we're just going to come up to this one side here. So in addressing the lower body here, gluteals here, and the gluteals are defined in the space just below or distal of the iliac crest and down to the common point of attachment of the hamstrings at the ischial tuberosity, which is the bottom of the hip. So we're going to be looking at the gluteals and the muscles below the gluteals, which are called the lateral rotators. There's 6 of them, and they come right off of the sacrum and attach to the greater trochanter of the femur. And along with that, we're going to include a couple of acupressure points that help release or help facilitate the movement of the blood and chi or energy through the area. So we'll just start with a little warming. In gluteal pain, a lot of times the first offender is the upper fibers of gluteus medius, and these are found just immediately below the iliac crest. So here's the top of the hip, and just immediately below or distal are the upper fibers of gluteus medius. And of the gluteal muscles, these particular fibers get the brunt of standing upright when we're walking or ambulating, or just a sustained stance in the upright position. So I'm just going to use my knee here and just sink in and lean down, so it helps not only loosen but create some nice space from the lower back into the gluteals. So nice and easy. That's very effective for general opening, but also to a very nice way for the therapist to start to get comfortable with using their knee in a therapeutic way, creating some nice space and loosening the muscle. So there's a series of things to do in loosening the gluteals. A couple of things we could do is we can bend the leg and use the flat of our fist here through a nice extended arm to loosen here the muscles. I'm bending the leg across the midline. In doing so, you can see that it brings the musculature up to the surface so it more readily receives some of the pressure. And body mechanics wise, I'm letting my energy or my body weight come through an extended arm and a neutral wrist, so there's no compromising with over flexing. And then just choose to use my knee here to get some nice general loosening gluteals. Pressure's okay, Melissa? Yes? Mm-hmm. You know, it's interesting when you really look at the different alternatives we have of working the body, especially when you consider the inclusion of your feet into the work. So on an anatomical structural position, we have the sacrum here, which is the bottom of the spine, and it not only anchors the sacrum and is the connection between the upper and lower body, but also its point of attachment for the gluteal muscles. So one thing I've been starting to do is using my heel sinking in and down, so my foot is supported with the ball of the foot, and I'm just coming down with my heel into the gluteal, just immediately lateral of the sacrum, out towards the acromion, not the acromion process, but the greater trochanter of the femur, where the muscles attach. And again, not only the obvious saving the wear and tear on your arms and wrists, but also the effectiveness of using the energy and the leverage and the power of your lower body to loosen the areas that we're targeting. Very nice approach. Here you can be very specific, and then you can just take it right into the hamstring. And again, like I mentioned before, it's the contour or the arch in the case of the foot that so nicely fits over the back of the leg. One thing that we should caution is that we want to keep the leg in nice alignment so that when you are adding compression down, you're not compromising the joint, particularly the knee joint. So a lot of times I'll take my foot like this, but also hold their leg up so I know that they're receiving the pressure in a correct way so that it's not compromising the knee. There's also a lovely, it's called leg lock, where you just lean in this way, causing nice pressure at the attachment just behind the knee. We move the leg into figure 4 here. And in this position, continuing loosening the gluteals, we have the option of coming in a variety of fashions. So here, I'm stabilizing in the lower body so that Melissa's leg stays in alignment. And in this position, the gluteal is right out in front where I can use my forearm to come in for some nice loosening. On larger clients, it's the same intention, but I would use my knee. I could just sink in this way. So here I'm right between the lateral border of the sacrum, but also the greater trochanter of the femur, right in this soft tissue trough, getting all the bellies of the lateral rotators along with the gluteals. So much compromise, lower back pain and gluteal tightness. So much. So always keen on looking at the gluteals as even a causal factor for some of the lower back pain that we feel a lot. The tight glutes and hamstrings, and also the iliotibial band, which runs between the gluteals and the lateral side of the knee. So addressing iliotibial band either with some palmar compression, or if you want to continue the theme, if it seems applicable, with the foot to come out and address in this fashion. Just sinking in. So Melissa just said that pressure was getting a little intense, particularly as I was most coming down to the side of her knee. So I would change that and move it in this way. Now it's a little bit more supported perhaps, so I can come up. So again, staying fluid enough, staying in beginner's mind enough to be able to change and do what's appropriate for the person in the moment, and not be adhered to any particular method or scheme, because there is no such thing as that when you start to work, because things are changing constantly, and we need to be fluid enough to change with them. Now here I'm adjusting the lower body a little bit too. The lower lateral compartment of the leg, peroneals, tibialis anterior, with some continued footwork. And remember, this all started with gluteal work, so in this supported figure 4 position, we can turn it to our advantage and use it in this way. So now my knee is coming up into the soft tissue, and I'm just going to use this position of Melissa's legs as a lever. So I'll ask you to inhale, please. And on the exhale, some really deeper release into the gluteals. And you can see from the therapist's point of view how it's nice and solid and supported. Nice contact here, and my bent leg is adding support for my upper arm so that I feel that sense of groundedness when I'm working, so that I can more readily focus on the pressure and the sustained breath. So it's easy. And just moving into the lower body on the other side here, taking a look at how that is. I like to add a lot of movement when I'm working to check from side to side, because there's usually some variance from side to side, because even though it has a shared function with the other side, it's taking the weight different. There might be some different alignment or misalignment in the body, so paying attention to that. Now in this figure 4 position here, with the hip and the muscles here, there's a particular series of acupressure points that are very key in releasing the lower body, particularly through the gluteals and the aforementioned iliotibial band. And one of that is gallbladder 30, which is called jumping circle, which is located right in the belly of the piriformis muscle, one of the aforementioned 6 deep lateral rotators. This is the most famous of the lateral rotators because of its positioning and functionability. It gets tight quite a bit, and it's easily located by palpating the bony landmarks of the hip in the posterior compartment, the greater trochanter of the femur, and again the lateral border of the sacrum. And at this 45-degree angle is where the piriformis is, and right in the center there is the belly of piriformis, is a little tender there. When you're looking for piriformis muscle, if you're going across here, it's like you're going over a little speed bump in the road. It's especially when it's tight. So when it's contracted both towards the center and towards the side, it's raised a little bit more, so you'll be able to feel it during palpation. So you can try to release it through either a braced thumb. So I take an inhale, please, and sinking in. You can come in with an elbow, forearm. You can come up with your knee, because this is a very nice supported position to get piriformis. I'm coming from a up position down into the muscle. My hands are supported on either side, so I can open or close the body when necessary, but also these two hands of contact add some very good support. So I can just come up and have you inhale again, please, and exhale, and my knee just comes right down onto the point. My knee here grounded, my foot here grounded, allowing my weight to shift from back to forward. And just to check to see how it is. It's still a little tight. So we'll do a little figure 4 on this side also. Seemed to work well on the other side. So first we'll loosen up the iliotibial band. This lower compartment of the leg here. And then come in using our knee as the contact point here. So we feel for the muscle, patella, take a nice inhale, and exhale. It's pretty strong movement, so you want to be careful, and you want to do a lot of general loosening before you go right into this. Okay, that seems to be moving a little better. So in addressing the hamstrings here, and again, just to, as a reminder, an anatomical reminder, we have these 3 hamstrings, the muscles of the posterior compartment of the leg, and they have common point of attachment at the ischial tuberosity. So in loosening hamstrings, it's always good to address the common point of attachment. So I'm coming in with a braced thumb and sinking in until you feel the bony ledge, and then just a nice sweeping back and forth here. Very nice. And then just doing a little point work here, addressing the individual meridian and muscle. So we have 3 muscles here: semitendinosus, semimembranosus, and biceps femoris. The biceps femoris is the one that has the 2 heads here. And it's the biceps femoris that has a tendency, when it's contracted, it can add to what's called a mock sciatic nerve pain, where this is a site of entrapment, where if the muscle is chronically tight, it will send pain signals down through and mimic, or actually engage, the sciatic nerve as it comes down. So we always like to check to see if they are saying or have been diagnosed with sciatic pain palpation, to find out where the root cause of the pain is, because she had mentioned that she occasionally gets a little nerve pain feeling, is what her words, down into the lower body, and if it was true sciatic pain, she'd feel more pain in her lower back where the nerve starts in the lumbar vertebrae, but she's not feeling that at all. So my suspect with that is either there's entrapment in the piriformis, which is the other site of signaling sciatic nerve pain, and we've worked that pretty well. So we're left with the hamstring. So I can feel right here there's quite a tight ridge here, so I'm going to be addressing that in a couple of different ways. I'm going to use my knee here to come, again, immediately just distal or below the common point of attachment of the hamstrings, just below the ischial tuberosities. I'm going to sink in this fashion. So I have a nice low center of gravity, so my energy settles really quick but easy and strong into hamstrings. And I have her leg bent, puts a little stability. I can hold on to this foot, and as far as being a therapist, I feel really nice and supported, so I feel easy moving my weight into different segments of the hamstrings. Also, too, a viable approach of using your foot here. Sinking in. And like I mentioned before, this is called leg lock, where you can bend the leg over and stabilize it here, and then just lean in with a little bit more weight. I can feel this sticking point right here on her, so what I'm going to try is what's called pin and stretch. So I'm going to go right into the affected area where it's very tight, and this is the outer head of biceps femoris, and I'm just going to engage it with my knee here and do what's called pin and stretch. So I'm pinning the hamstring, and now lowering the lower portion of the leg is a pin and stretch move. The action of the hamstring when contracted brings the leg up. So pinning it and then lowering it is pin and stretching the muscle, taking it all the way down. So feeling pretty good about that. Let's just see how the motion is from side to side. There's always that sense of addressing so as to help release lower back pain and hip pain. So here in this position, I'm placing my arch of my foot over the lower lumbar of Melissa's back, just above the iliac crest, and I'm going to come down, and I'm not bending at my waist, but rather lowering my body. I'm going to have a nice inhale, please, and exhale, just going to come up. Because the piriformis, the iliopsoas attaches on the lesser trochanter of the femur, this raising of the leg really stretches it because I have its point of attachment in the upper body stabilized by the bottom of my foot. And just a little deeper stretch. And just see. Okay, finally a little softening here. So this is very good. I'll say that's some time well spent. And just to conclude with a little grounding technique at the feet, here we can choose to do some nice grounding moves with our feet on their feet. There's so many ways of addressing the lower body. We can come and face away if we choose, and just use our heels, which I think we'll do here. Alternating pressure into the bottom of our feet. And then finally, nice grounding movement by using our knees in the bottom of our feet. This also helps facilitate the movement of energy and chi down through her lower body into her feet, so that not only does it give a sense of completion, but also a sense of groundedness, especially when she gets up and starts to walk around. So I want to thank you for viewing this video.